Hello, everyone. My name is Avi, and I'm a senior software engineer here at Cardio AI. And I'm going to be taking you through this clinician's dashboard demo. And I'll let Samson discuss a little bit more about this.
Hi, and I'm Samson Kontoma. I'm the founder and CEO of Cardio AI, and I will be going through product demo section with our senior AI software engineer, Avi. We will go through various sections. My role in this demo will be to highlight on the clinical usages and meaningfulness of this product. So, Avi, get started.
All right. So before organizations can get access to our system, they'll first need to register. And on this registration page, they'll be asked to fill out basic details about their organization and enterprise. And they'll be asked to select a tier, which consists of basic, tier 1, tier 2, tier 3, and enterprise, which consists of different features according to what tier you select. Once that is done, they'll get access to our system and be able to sign in. And once they sign in, they'll be able to access the clinician's dashboard. So currently I'm on the full enterprise application, and this is going to be the agent statuses, which you will see on the main dashboard. Clinicians will be able to perform quick actions such as adding new patients, searching patients, running some diagnosis, or looking at AI prognosis of a specific patient. Next, we can move on to user management system. So in this user management system, admins are able to create new users, and they'll be asked to fill out this basic information and select the role for that specific user, whether it's an admin, staff, or patient. And once that is done, they'll be able to view the roles and details and delete user records. Next, we can move on to the patient profile overview. And in here, you'll be able to get access to patient details, their live vitals, their monitoring, and the full report of a specific patient. Here we have a patient, John Doe. We have his full report. In that full report, you'll be able to see their EHR summary, their symptom analysis reports, diagnostic summaries, risk stratification, etc. And once that is done, we can also see the live monitoring vitals of that specific patient. So if there's any abnormalities, clinicians will be automatically alerted and they can access his patient profile and have teleconferencing with the specific patient through our telemedicine conferencing platform. Next, we move on to our patient's clinical portal, which we will be assessing a specific patient's request. And we will be first looking at our basic tier, which will consist of symptom analysis, and I'll let Samson take over from there.
All right, this is the symptom analysis tab, is the basics tier. We are planning to offer this as a free tier for everybody to experiment with. Basically, it's a symptom analysis taken from this tool. You will be able to, as a clinician, to conduct analysis of your patient based on the symptom they report on daily. And we have them on various categories. If it is chest and pain, you will go to. So chest and pain, select the section on that. If it is crushing, it's pressure, it's tightness. So let's say it's burning. So let's select burning for this particular demo. And a pain radiating to the arm, let's select yes. So let's move to respiratory. This patient is experiencing shortness of breath. Select shortness of breath. First up, let's go to general symptoms. This patient is experiencing sweating. So let's select sweating. And let's say the cardiac rhythm. This patient is experiencing palpitation. Select palpitation and analyzed. So quick one, within a second, you get the results of what is going on with this patient. And the primary concern is heart attack. The score is 15 and this is critical. It's already indicated. So we also have cardiac rhythm as moderate and heart failure as moderate. So the physicians will have notification of this information, or if it is through the remote patient app, they will be alerted and notified. And if it is also through the clinician dashboard, they will see this and take proactive measures. This is one of the proactive measures using our remote patient monitoring tool to make sure we improve quality of life. So let's move to the next section, which is the clinical analysis.
Right, so this will be our tier 1 feature where clinicians can enter basic information such as the chief complaint, the medical history, and current medications for a specific patient. And this will be using EHR data to conduct analysis. Back to you, Samson.
All right, so this is, as he has said, our tier 1 is purely clinical analysis tool. The data used in that is purely EHR data and clinical note extraction. So it's used to conduct clinical analysis and see what is going on with this patient as a first stage of the diagnosis process. So you can go to the request and let's see the use cases here. So we have a request here made by a clinician or a cardiologist or whoever that is using it. This is the request number, the patient name, and all the information. The complaint or chief complaint is chest discomfort. So so they did the analysis. Our agents did the analysis and got acute coronary syndrome suspected. Confidence level is 87. So let's view the report of this particular analysis. So the diagnosis or suspected condition is coronary artery once again, and a high probability based on the symptoms, history, and elevated cardiac markers. So we have extracted data is conditions of this patient is hypertension, type 2 diabetes, suspected coronary artery disease, and medication is linezolid 10 milligram daily, and metformin 500 milligram twice daily. And treatment plans recommended is aspirin, 325 milligram to start with, and then reduce to 81 milligram daily. Atorvastatin is 400 milligram daily, and metoprolol is 25 milligram twice daily. And the system also recommend agent cardiology referral within 48 hours. And this can be done through using the tier 2 to conduct a further analysis of this patient. So let's move on to the next tier, which is the tier 2.
All right, so this will be our tier 2 diagnostic analysis system. This will consist of EHR, ECG, and imaging data. Clinicians will just fill out these general informations and the symptoms that the patient is experiencing, and they'll be able to conduct a full diagnosis. And I'll pass it over to Samson to continue.
All right, so this is tier 2 of the multi-agent system. So if you have this subscription, so this is a higher level than the tier 1, the data by the data modalities. So this has increased from the EHR data now to ECG data, lab data, and then imaging data to be able to conduct analysis of this patient, of each patient. So it's one of the major tiers in this multi-agent system. We also have the automation policy that outline the automation tiers, if it is tier 3, tier 2, or tier 1. So in some cases, based on the confidence level, it is going to be autonomous and need agent action. In some cases, if it is semi-autonomous, that required cardiology or physician review of an approval before any action can be taken. If the confidence level is very low, it's just purely informational or educational. So let's go to the use cases to see how it works. So this is a service request sent, and this is the request ID. And as displayed, and based on the analysis, it was a tier 3 in agent and acute inferior wall myocardial infarction. The ICD is there, 121.19. The confidence level here is 98%. So that makes it a tier 3 very agent. So let's view the report of this one. And based on this report, we can see that the clinical findings are that the patient ST elevation is 3 millimeter in least, 2-3 in AVF. The labs troponin level is 5.6 nanogram per milliliter and is elevated. And echo wall motion abnormality estimated ejection fraction is 28%. So what do they recommend? Immediate activation categorization lab, and also recommending aspirin 325 milligram MAV to start with. And clopidogrel is 600 milligram loading, and door to balloon less than 90 minutes. So this is just the first one. Go back to the second case. And then the second case is tier 2 recommendation. So based on the confidence level that we have for this is 87. So this has to be reviewed by a clinician before any action can be taken. Unlike the first tier, tier 3 is agent and autonomous. This is semi-autonomous. So go to the review tab. So under that review tab, you can see is the risk level is critical. You can also see the confidence level is 87. What are the clinical findings? That the ECG Q wave is present, and then the labs LDL is 165 milligram per deciliter. That is the lipid level, and ejection fraction is 45. Mild LV dysfunction. The recommendation is that stress test recommended, statin therapy, ACE inhibitor, and lifestyle modifications. So let's move on to the next tier, which is the tier 3, that includes the tier 1 and tier 2.
So this complete diagnostic analysis will be our tier 3 enterprise system. And this will just allow clinicians to enter basic information and get access to all of our different agents we currently have. They'll be able to select the request type they want, like ECG, echocardiogram, lab results, imaging, the Internet Medical Things data, or comprehensive analysis. They will select the urgency level and then the chief complaint that a patient has and the different symptoms that they're experiencing. And I'll pass it over to Samson to continue.
All right, so this is the tier 3. That includes almost everything about our multi-agent system for cardiovascular disease. And as he has already said, scroll down to the request type. So we have various requests under this. So they can use this depending on what they want to do or what analysis they need on the patient. So they can do ECG analysis using the ECG or echo using the echocardiogram, or they can do the lab analysis using the lab agent. So very important here is the medical imaging and then the Internet of Medical Things agent and comprehensive if you want to do all. So let me start with the medical imaging. So go back to the medical imaging, which is impacted by our PACS and DICOM system for imaging studies. Go to the imaging studies dashboard and let's see what we have here.
Right. So for the imaging studies, we can currently see the studies that have been currently processed, the ones that are currently processing, and the ones that are currently pending review from clinicians. We can see the average processing time and the accuracy of our agents. Next, we can move on to the studies tab where we'll be able to see all the studies that have been conducted. I'll pass it over to Samson and continue on.
So these are various studies that were requested by the physician. And as you can see, the studies level, some are completed, some are processing, and some are still have completed. So the first one is the echo studies. That is the echo modality, and it's a routine studies. That's the priority level. That means they want to recheck on this patient to see what is going on using echo. And we can move on. The next one was MRI, and that is agent. They need it immediately, and it's still processing. The other one is the CT scan, and that one is also completed. And what is the priority level is start. So that's initial coronary artery disease CT scan studies for this particular patient. So let's go to the detailed section of each of these studies to see what the analysis are. So this is the echo studies of this particular patient. As we can see, what were the findings? The findings is that is normal ejection fraction of 62%, no significant abnormalities. So that is it, a routine studies. So this patient is improving. That's good echo analysis for this particular patient. Let's move to the next one. So the next one is the MRI study. And what is the MRI study? We don't have status. The status is still processing. That's it. So there is no any analysis or diagnosis on this particular study. But it's very urgent. So they need to get it on time so they can work on this patient. So go to the next one. So the next one is coronary artery CT scan. And as you can see, the status is completed. What were the findings? Critical findings are that 70 to 90%, 99% stenosis in proximal lat. And this is a high-risk plaque features. What are the key findings? The calcium score is high, 450. And there is also severe stenosis in the lat. And that is talking of the walls of the arteries. So in the lat part of the arteries of the wall, they have severe stenosis there. So let's move on to our the next section on that tier 3, which is the Internet of Medical Things. So you can move straight to the Internet of Medical Things dashboard.
All right, so this will be our real-time patient monitoring hub. Currently, we have 4 active patients and then 2 active alerts and the total devices that have been connected. So currently, we have a patient, John Anderson. We have his MRN number. His condition is critical. His heart rate is 145, their blood pressure, their oxygen levels, and the devices that have been connected. So currently, one of the devices that are connected is an ECG monitor, which is live streaming his vitals for ECG. And if anything goes above abnormalities, then clinicians will be automatically notified. So here we also have the heart trends for the last hour. And if there's any abnormalities, again, clinicians will be notified. And here we can see that there's an active alert. We can just see that atrial fibrillation with RVR is detected, and clinicians will be notified and they'll be able to take appropriate actions. So on the connected devices, we see that there's an ECG monitor and there's a blood pressure cuff, live streaming those datas. Next,
So,
yeah, go ahead. Go ahead.
all right, continue on that note to the next patient.
Our next patient is Sarah Chen. Her MRN number, her physiological data, heart rate, blood pressure, oxygen, her device is connected. We can see that she has an ECG monitor and a pulse oximeter, and she currently doesn't have any active alerts. And I'll give it over to Samson to talk about the risk assessments and the AI recommendations.
So as you can see from the various patients, they all have different levels of physiological data, and we have devices that are connected onto them to get this physiological data. That is very important, but very much more important in this particular tool is that it is a remote patient monitoring tool that help for patients to still engage with their treatment team after they've been discharged from the hospital. Let's say a patient have been admitted for heart attack or any of the severe heart cardiovascular disease, and they discharge them. They can still use this remote patient monitoring tool. Any device they are blocking will monitor them remotely and then send any alert, any critical data alert to the treatment team for proactive measures. So this is one of the important aspects of the multi-agent system products, as it is done to improve quality of life through this patient remote monitoring and also reduce mortality rate. So it's very, very important, as I had a personal case that led to this particular section development. A personal friend of mine was admitted for heart attack. He was treated and discharged, and then he went home, and then the next 48 days, he fall into coma. They took him to the hospital, and that was the end of it. He died. So if we have such a tool that will be able to monitor every physiological data, any device the patient is in, and give report critical alert to the treatment team for proactive measures, his death could have been prevented. So this is what this tool is about. And as you can see, there is a risk assessment section. If you are using this tool for your patients, it will be able to assess the 10-year atherosclerotic cardiovascular disease risk, heart failure risk, and stroke risk, or sudden cardiac death risk. Will be able to track all of that and report to the treatment team for active measures. So it's one of the very powerful section of the multi-agent system. So I will hand it over back to Avi to continue with the rest of the sections on this product demo.
All right, so our next major core feature would be the prognosis. And this prognosis will be available for each patient. So our current patient is John Doe, and you'll be able to see their survival probability, their readmission risk, and any other risks that have been calculated using his data. So currently you can see the prognosis trends for the past 30 days, their readmission risk and survival probability, and you'll be able to see clinical recommendations for that specific patient. So we also have other tabs for treatment plan, genetic analysis, ECG, and analytics, where clinicians can do other sorts of analysis for the patients they currently have. And one last thing before we conclude this presentation is going to be our alerts and notifications tab. So here, clinicians will be notified of any alerts generated from our system, whether it's from the Internet of Medical Things data or it's from one of our diagnostic agents for a specific patient. And they'll be able to actively treat patients based on these alerts if there's critical or any other types of notifications. And that concludes our demonstration for this product. Thank you very much.
All right, Avi, thank you for this clinician dashboard demo and analysis. The next, I will call on Mahita to do the presentation on our patient dashboard, and I will give an introduction. Mahita.
Mhm. Hi, I'm Mahita, and today I'm going to say about the Cardio AI Patient app, mobile app, and I'm working as a software engineer at Cardio AI.
And I'm Samson Kontama. I'm the founder and CEO of Cardio AI. So this patient mobile app is one of the remote patient monitoring tool to enhance proactive treatment and guidance and engagement of patients with their treatment team. So it's one of the powerful sections. Patients can use this at home, while at home, to track their physiological data, log in their daily system and their daily risk assessment. And they can even further do conduct their own symptom analysis on this tool, and any critical data will be immediately the treatment team will be immediately alerted for proactive measures and treatment. So I will hand it over back to Mahita to go through the various section of the patient mobile app.
Yeah, on the home screen, we have three quick summary cards that update throughout the day, which is adherence card and today's AI calculated cardiac risk level, and the next appoint, and the third displays the next visit. And down to that, in the main dashboard, we'll be having the physiological data, which shows life health data like heart rate, blood pressure, glucose, and step count. These are all synced with the automatically Apple Watch, like Apple Watch, Fitbit, and healthcare devices. And we also have the real-time alerts like in the continuous monitoring tab, like detecting conditions like arrhythmia and or abnormal heart rate. Each alert includes details like severity and recommended actions. And next to that, we will be having the medication card, which is the treatment adherence, where the patient, it helps the patient to manage prescriptions, schedules, reminders, and adherence charts. And finally, in this, we'll be having the reports and education section, provides the access to lab reports, ECGs, and an AI powered assistant that also offers personalized health education. And here we are also having the teleconsultation options, and this design follows the card layout based. And coming to the daily form, which helps the patient to log on their symptoms and vitals each day in just a minute. Like if a patient is having the chest pain, and we can also select here the severity level and the frequency of how much he is getting, and we can submit these symptoms. Then he'll be getting the live tracking of what he is going through. And down to that, patients can select the symptoms, daily risk assessment, where with simple yes or no questions like, are you experiencing the new chest pain and all. If any answer signals the risk, the app shows a friendly warning suggesting a review with a care team. Users can also input the vitals like heart rate, blood pressure, weight, and oxygen saturations, and also submit them to the care team. And here we'll be having the advanced cardiac symptom analyzer, where the users can give the where the users or the doctors can give the input and can find the what the patient is going through in minutes. So now Samson will be.
All right. So for the advanced cardiac analysis, symptom analyzer is also in the patient app, and this has it went based on the symptom daily log sheet and also the risk assessment daily log sheet. They can easily fill out this form. Let's go through this example. For instance, they say they have the pressure. They have a pressure, and let's select. They also have shortness of breath. For the respiratory part or student shortness of breath, you can select the first one. That's okay. Just one, select one of it, and go to the general. Let's say they have dizziness, and the cardiac rhyme. They have palpitation. Let's say palpitation, and then analyze. And then we get this patient is critical primary concern is heart attack, and the score is 15. So this will need to be, physicians will be, or the treatment team will be alerted for proactive measures. So there's also a second condition, which is cardiac arrhythmia moderate and heart failure moderate. So the patients, the treatment team can take this test as the first step in their investigation onto this patient condition. So it's a very useful tool for the remote patient monitoring, and also very useful in proactive measures for the treatment team, all done to do what? To improve quality of life, reduce mortality rate, and have better outcomes for patients. So I will end here and hand over back to Mahita to conclude the patient dashboard.
Yeah, this, as Samson said, this advanced cardiac symptom analyzer will be assigning all the details and giving the output. And here, the Insights tab explains how the AI prioritizes and calculates the scores, that turning the raw symptom data into the meaningful for both patients and the doctors. And to wrap up, Cardio AI brings together the real-time health tracking, guided symptom logging, and advanced AI analysis to make the heart safe and clear and fast. Thank you.
All right. This brings us to conclusion of the presentation